when I got the invitation from Fred a couple months ago, I was really hoping I could make it here today because I knew if Fred was organizing a conference, it would be exceptional. And I have to say, you've already exceeded my very high expectations. So thank you and congratulations. I want to talk about the role of social protection as an economic strengthening mechanism. And if we look at Sub-Saharan Africa, over the past 15 years, back in 2000, these programs, and these are like mostly cash transfer programs, the government simply giving money to the poor, mostly with no strings attached. And these programs were concentrated in Southern Africa 15 years ago. Today, you struggle to find a sub-Saharan country that does not have these programs. For the past 3 years, EPRI has been, my research institute, has been working with UNICEF to look at how these programs have an effect on health outcomes, particularly in the context of HIV and AIDS. And directly, they do three main things. First of all, they increase developmental awareness. I'll talk more about that during the questions. They provide access to goods and services, particularly food, and they promote income security. Now, as a second effect here, they tend to improve educational outcomes in almost every country where this is evaluated. They also empower, particularly adolescent girls and young women. And they reduce risky behavior through sometimes complex mechanisms we don't quite understand. And through these three indirect effects, we see a lot of impacts in terms of prevention of HIV infection, treatment, adherence, and improved treatment outcomes, and care and support. Now I'm focusing on that little yellow box up in the upper right-hand corner, social protection as economic strengthening. Now this comes through a number of mechanisms, and I want to talk about some evidence from Kenya's OVC program. That has way too many words on it. Can you turn that into a picture? Thank you. Okay, great. Much better. Okay. So Kenya's program, handing cash transfers, about $20 a month, to caregivers of young, vulnerable children. We see that having a direct education impact, and through that education impact, in adolescence, a delay of the age of first pregnancy, and then a direct impact from HIV, from education to HIV prevention. And then also improved mental health, particularly for young men, and a delay of the age of sexual debut. Now, I can talk more about these results. I want to get through a lot of evidence in the next 10 minutes, but I just want to lay this evidence out first. In South Africa, with a child support grant that is part of a system of cash transfers that reach 2 out of every 3 South Africans, we see an impact from the biggest grant, the child support grant, in terms of reducing the kind of risky behavior that puts adolescents at risk of HIV infection. Some of this comes through the education effect, but some of it seems to come through an empowerment effect and other effects that I think we'll hear more about from Lucy a little bit later this afternoon. But to give you an idea of how complex this is, we did an evaluation of adolescents who had received the child support grant in the first 2 years of life, and others who only started receiving it 5 years later. And the impact of early receipt had a significant impact in terms of reducing these kinds of risky behaviors that put the adolescent girls at risk of HIV infection. Now, there are a range of other effects, and across the continent, there have been a number of randomized controlled trials and other evaluations that show the education impact at secondary school level of participation in these programs. These programs don't aim to improve education. They aim to reduce income poverty. Very simple economic strengthening mechanism. Yet the impacts on education across the continent are the same magnitude as those for the conditional programs in Latin America that specifically focus on educational attainment. In terms of other health outcomes, these are a number of studies showing a range of impacts in terms of improved health outcomes and improved health-seeking performance. I won't go into all these details. I'll be happy to answer questions. Another interesting result is that participation in these cash transfer programs is associated with improved livelihoods. At community level, through these kind of local economy effects, where the money circulates within local communities and stimulates economic activity, but also through human capital development effects that have long-term impacts in terms of breaking the intergenerational transmission of poverty, and also through simple things like helping households manage the risk that make it hard for them to pursue more productive livelihoods. When people have some income security, they can take advantage of those high-risk but very high-return opportunities that can break them out of the poverty trap. Now, there's a problem here, though. These programs mainly aim to reduce income poverty, and yet they have all these other effects. The question policymakers have in many countries is, are we doing enough to coordinate interventions to maximize economic strengthening impact? Or are these programs in a silo, just working to reduce income poverty, and we have all these ancillary effects as a bonus, a bit of gravy on top of the very substantial impact, reducing 2/3 of the poverty in South Africa, for example, from these programs. In Ghana, the government has coordinated what we call intra-sectoral linkages, cash transfers with a social health insurance program. So cash transfers on their own cannot do much to prevent the impact of catastrophic health shocks. Social health insurance can, but the poor often can't access it because they don't have the money to pay the premium. Ghana has joined these two programs and in the process strengthened the mutual impact of both of them and gotten 90% uptake of this social health insurance program. In South Africa, the government's asking if 1 out of every 5 rand we spend on our government budget is a direct handback of transfers to the poor, can we get something more out of these programs than all these great effects we've just talked about? Can we design these programs more comprehensively to generate economic strengthening? So the Department of Social Development has, through the Economic Policy Research Institute, implemented a pilot these past 3 years. First of all, focusing on financial inclusion, promoting economic incentives to save, a doubling or even a tripling of the savings of poor households, financial literacy programs, and facilitated access to bank accounts, aiming to enable youth to save for their future education or to start a small business. And the second thing they've done as part of this program has been implemented a youth development intervention to keep youth in school. When I heard Mary talking earlier this morning about the Step Up program, I said, this is exactly what we need to figure out how to do in South Africa. Because if a youth drops out of secondary school, their economic future is lost. In a climate of 40% unemployment, those who drop out of secondary school face 100% unemployment. And so this second part of the intervention, and this is a randomized controlled trial. The first arm is this financial treatment that I just described. The second arm is a youth development intervention. And the transmission mechanism there is these savings enable youth to access the resources upon graduation to go to university. The financial aid scheme has guaranteed that every youth who goes through this program and saves the funds to pay the registration fees will get the financial aid they need if they succeed at university. And it then ultimately leads to more sustaining livelihoods. Key to this is that psychosocial asset we call hope. Now, this is still a new program. It's been going for about 2 years. The treatment is about 1 year in, but we already see through the preliminary monitoring results some important impacts on household savings, people in the first treatment getting just the financial incentives and literacy and facilitated access are saving about twice as much as those in the control group, which is about the same as what the results were at baseline. And in the comprehensive treatment, that's both financial and this youth development, they're saving 3 times as much. The leading indicator on development, we're going to have to look out 2-3 more years before we can really say things about youth accessing economic opportunity. But the leading indicator is how many days of school are they missing. And the youth in the treatment programs are missing about half as many days of school as those in the control group. There are some surprises. For example, the financial treatment has a more significant impact on the developmental outcome, and the savings treatment has more of an impact, or the savings treatment has more of an impact on the comprehensive outcome. And so there are a little bit of surprises here I can talk more about, but there's certainly some promise here that these kinds of complex interventions can contribute to economic strengthening impact. Thank you.